we can do this together. If our hospital is the pillar of confidence in the community, then I have to be the pillar of confidence amongst our employees in the hospital.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Last week, we announced a series of special podcasts on a weekly basis related to the topic of COVID-19. Our most recent podcast in this new series was co-hosted by Dr. Britt Berrett and joined by Matthew Troop, President and CEO of Conway Regional Health System. Today, we bring back Dr. Berrett with another hospital CEO, Dan Springer of Lea Regional Medical Center, which is part of the community health systems located in Hobbs, New Mexico. Britt, thanks for joining us again this week, and welcome, Dan, to the podcast.
It's a delight to be with you, and thank you on behalf of the Center for Healthcare Leadership and Management. We believe these podcasts provide tremendous insight and perspective, and we've invited a number of practicing healthcare leaders from all across the United States to share what they're actually doing, the reality of the challenges they're experiencing. So today, Dan Springer is a good friend, has a tremendous history and background. He's the CEO of Lea Regional Medical Center in New Mexico. And as he and I were talking about the challenges related to this pandemic, I thought we'd get him on the podcast and ask him some pointed questions. So, Dan, pleasure to have you with us. Thank you for joining us.
Yeah, thank you for having me. I'm excited to be here and talk a little bit about it. It's what I spend the majority of every day focused on now, and so I'd be more than happy to talk about.
Thank you. To that end, let's jump into it. Bob, are we good to go?
We are ready to take off here, and let's go deep and find out some things that our audience is interested in. And Dan, our audience is a broad range from students, from undergraduate to graduate to executive ed, and leaders out in the industry as well. So we've got a very, very teed up audience for you.
Dan's a young CEO and has taken the helm of an organization that has tremendous regional responsibility. Dan, can you just give the audience just a brief snippet of your history, your undergraduate, graduate, and how you got to sit in the seat?
Yeah, absolutely. So I did my undergraduate work at Brigham Young University and in exercise science and a business minor, and then went on to do an internship at Texas Health Resources for a year after that. And then before I went into my master's program, got my master's in healthcare administration from the University of Minnesota. And straight out of the graduate program, I went to work with community health systems. And my family and I have moved around to a few different hospitals in the following years as I was promoted through the company and then took another opportunity. So I've worked in hospitals in Washington State, Florida, St. Petersburg, Florida, and then left CHS for a time and went to LifePoint and was the market chief operating officer of a 2-hospital system in Lander and Riverton, Wyoming, and then came back to community health systems here in New Mexico as the CEO.
I point that out because nothing's linear. There's no consecutive steps as you navigate through your healthcare role and responsibility. But you're now the CEO. Let's talk a little bit about your facility. A lot of people have asked the question, what have hospitals been doing to prepare for a pandemic? And I think it's interesting and insightful to share some of the things, not knowing there would be a pandemic, but what kind of things have you been doing in the past in preparation?
Yeah, so, I actually was thinking just recently about the first time that I participated in a hospital incident command scenario, which was as an intern at Texas Health Presbyterian Hospital, Plano. So that's one of the ways that we prepare, right? We do at least 2 drills every year that includes our hospital incident command system. And so we have an incident commander. It's some sort of event that warrants a significant response to it. So, all of your hospital leadership is involved in responding to the emergency. And I was just thinking on the first time that I ever participated in one of those hospital incident command scenarios was regional down in Dallas. They had said, at a stadium, there had been some mass casualty event. And so there was community-wide coordination to be able to handle it. And so we all worked together. We had to begin communicating with one another I was chosen as an intern as the liaison officer, which handled all the external communications, which I wasn't prepared for, but was a very fun responsibility to jump right into. And so I really enjoyed the opportunity to see it. It wasn't a real event. So it was from the preparedness perspective, how we work together to be able to, all the different healthcare organizations to be able to handle an event like that. And so there's many different ways to answer your question that we prepare for it. It's just that we never know exactly what we're preparing for. So we have something called a hazard vulnerability assessment that every healthcare organization has to create and maintain. And that's where we identify the risks that are unique to our hospital. So when I was in Wyoming, the risks that were most present were snowstorms and the inability to have staff make it to hospital because of the overwhelming cold weather or amount of snow that we would get, or windstorms, or different things. So every different organization has a hazard vulnerability assessment that they complete and update every year and review. And then you perform incident command scenarios and drills based on those. And we have emergency operations plans that have to be continually updated and approved and reviewed. We have emergency management meetings, reviews, tabletops, all sorts of different things that really help us to consider, or best consider, all of our risks and how we would handle those should the scenario arise.
It's interesting you should say that, because all that scenario planning creates possibility thinking, right? But no one ever imagined a pandemic, right? I don't think that was ever a scenario that you guys contemplated. Is that accurate?
That's true. You might have some feeling of it, like a patient surge, but it's never, I have never been involved in a drill where we had a pandemic. We've never had to go through that.
In my 25 years as a hospital president, I never did as well. And it was interesting. I got called by the Dallas Morning News, and their question was, hey, what are you going to do? And my response is, well, we're going to have to wait and see based on the dynamics that occur. So let's pivot right now. You're in the midst of it. You're in the middle of it. Tell us what you're doing and how you're orchestrating these resources in such an ambiguous time.
Yeah, absolutely. I think to take a step back from that, I think being in the midst of it, one of the coolest things that I've seen has been how a team functions, especially in healthcare, in an emergency. There's so many talented people with such significant training that all band together to be able to, with different functions, that all work together with a common purpose. And it's been really incredible to watch a team function in an emergency. We have not been hit significantly yet by COVID-19, so we have had one positive result, which resulted with an inpatient here in our hospital. That patient was treated and discharged home to quarantine. And so we haven't had a significant hit yet, but we have taken extensive preparations, and it's a constant topic in all of our meetings. It's what we're spending the majority of every single day preparing for. We have models that are projecting exactly when we'll see our influx. You see the increases, the tallies continuing on an exponential rise across the country. And so being in the thick of it, there's a lot of things that are happening in order to prepare ourselves and respond to the need. So one of the most overwhelming things has been the amount of information that has come from different sources. There's constant communication needed in order to respond to the ever-changing guidance that's given, whether that's from the Department of Health in the State Hospital Association, the governor issuing executive orders, the American Hospital Association, the CDC, CMS, all these different areas that have information that we're trying to share with multiple sources and have in a coordinated way. And so one thing that Community Health Systems has done and really done a great job on has been sending a daily update with the most updated information and how we can be responsive and the actions that we need to take. And we have a series of phone calls that we have daily so that we can coordinate with each other, from passing information down to the local level at a hospital. And then my responsibility there, and one thing that we have here, is that we have daily safety huddles. And so every single employee in our hospital is involved in a daily safety huddle.
Whoa. Let's pause for a moment. every single one of your hospital employees pauses for how long do they do the safety huddle?
It's about 10 minutes, 10 to 15 minutes.
And that's on all floors throughout the entire entity.
Every employee is involved in a safety huddle at the beginning of every single shift in their department. Yep.
And they raise issues, they discuss concerns, they share communication. 10 minutes, and then you get back to work.
Yep.
Best practice.
And whether that's day shift, night shift, anything. And that's one thing that community health has had in place for a long time. So every single hospital that is part of our system, every single employee is getting the information that they need to at the beginning of every shift.
Now, you mentioned that you haven't seen the volume as anticipated, but you've got to be prepared. That's got to be a hardship on your organization and your personnel. What kind of pinch points are you experiencing when you are preparing but not experiencing a COVID patient and the volume there? What are some of the pinch points?
Yeah, so one is that we're not immune to the normal business operations that we have to be able to flex to our volume. So as we have in New Mexico, for example, the governor put out an executive order that all non-emergent procedures or anything that could be delayed should be delayed. And so we have a significant reduction in our outpatient surgery and all of our outpatient volumes. You can imagine that most people are staying home. Our clinics are seeing less patients. So we don't have all of the volume and revenue coming in, so we can't experience all of the expenses that we have as well. So that's been one pinch point that even though this is a national pandemic and we have all of these preparations to go through, we still have to be responsive to our actual business operations, that we need to be responsible operators at the same time.
Yeah, that's a great point. So you have the expenses, you just don't have the revenue. Are you experiencing any fatigue by the personnel being in a constant state of readiness? And if so, how are you helping your employees kind of navigate that and be uplifted?
Yeah, one of the ways is honestly we've had to call off some employees since outpatient surgery is down or our clinics are down. We have the ability to move some of those and be supportive in other departments. So some of our outpatient nurses can have some orientation in our emergency room, even though it may just be an extra set of hands. That's still helpful to be able to spread some of the workload amongst many people. So you can imagine our emergency department is overwhelmed with it, and they're on a constant level of readiness for it and have some influx and have more phone calls and have a lot of concerned people. And so we use some of our other employees to be able to supplement that staffing in other areas, which has been helpful.
That's smart. And so you're looking at limited resources and allocating those. How about supplies? You okay with ventilators and personal protective equipment? That's seemed to be a national issue. How are you all doing?
Yeah, since we haven't seen a huge influx yet, we still remain ready and prepared. We have several ventilators that we're able to operate here. It really we just wait to see how many patients we actually get, right? So, I mean, there's a big question mark out there of exactly what are we ready for. But we've been pretty overwhelmed with, not only is it wonderful to see the coordination of a team that responds to an emergency inside the hospital, but it's been really great to see the community response as well. So there's people who have sent, just the other night, I got a phone call from our emergency room nurse who said, somebody just sent us 30 pizzas. And that's more than one pizza per person in the emergency room. So they spread that amongst the whole entire hospital. And so not only have we had community members who feel like they want to give back at this time when, our healthcare workers are seen as heroes, but also, we just got 2 pallets of personal protective equipment from Harbor Freight, who donated us significant supplies. And so from N95 masks to gowns and those things that we're currently concerned with. I mean, just the other day, we got down to a 1 day on hand of N95 masks. And then you see additional response and coordination from like Community Health as a corporation is able to reallocate some of their supplies as well. And so from many different perspectives, you've had a tremendous response and a lot of people pitching in from, lifting where they stand of being able to contribute and give back. And it's been pretty incredible.
That's inspiring.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands.
The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
You talk about communication, and before we pivot into lessons that you've learned things into the future, talk to us a little bit about communication. When you think about communicating with personnel, with physicians, with community, what's in the back of your mind when you're messaging them? What are you thinking?
Well, I want to help people know that we're prepared, that we're here for them, and we're ready to be their healthcare provider, and that they can have confidence in us. So if we can't be the one who they can have confidence in, then really they don't have much in anybody at this point. So we need to be a pillar in all the madness that's going around. We need to be a pillar of confidence that they can come to us when they have a problem, when they need to be tested, when they have, that we're there for them. And so that really is the most significant part, is that we have to be constantly communicating with many different stakeholders, from, like you said, medical staff to employees to the community. When we had our first positive in the community, we had a press conference with city leaders and with the county emergency operations center. And so we did a live press conference over Facebook and different things, and to get that out to the community. And so we really want people to feel, not only know what they need to do, but feel comfortable with the action that we're taking and the preparations that we've made.
You play such an important role, and it's inspiring to hear how you're leading that organization. With that in mind, changes are afoot. What do you anticipate the future to be? What kind of different changes or behaviors or programs or initiatives? What's the future going to look like, Dan?
Great question. I don't know that I know it exactly, but I think that it'll change the way that we prepare in the future. Certainly, we'll probably add some complexity to our emergency operations plan, our stockpile of personal protective equipment for sure. I mean, we'll have more on hand and be able to respond to a bigger need. I think that our coordination and collaboration between not only healthcare facilities, but public service, a state government, the federal government will improve. I'm sure that new programs will come out of it. One thing that we've seen as a result of this pandemic is that the government really has had an immediate relaxation of many things that in the past have made it difficult for us to operate efficiently. So stepping back on HIPAA and allowing us to do telemedicine, having hospitals without walls, them releasing the hospitals without walls, that we can have alternate care sites. I think in many different ways, we've been able to respond and see where the pain points were that were not allowing us to operate as efficiently as we could before. So allowing providers from other states, if they're licensed in one state, they can come over and help us in New Mexico. Those from Texas just across the border from us can come over and help us. And so I think there's a lot of coordination and collaboration that will occur as a result of this. And so I think also it makes all your preparations a lot more real. For not having been through a significant hospital incident command, when you've actually been through it, it makes all your preparations a lot more serious. And you know exactly that this isn't just a fun drill anymore. It's actually, this is going to really happen. We're doing things right now that in the emergency room, we get together before our daily safety huddle. So we have one with all of our leaders that we do our safety huddle. Then they go out and have theirs with their employees. But we're also doing another one right now where in order to prepare, we're getting together with our ER team, reviewing any transfers that we had the day before for someone who may have needed a higher level of care, or a physician a specialty that we don't necessarily have on staff here that needed to be transferred to another facility. We review all of those and then ask our staff what would happen if we were not able to transfer that patient. So what resources do we need? What supplies do we need? What people would we need? What training would we need in order to care for that person here when typically we wouldn't, because we're not able to transfer elsewhere? And so I think that it brings up so many questions and so many points where you haven't thought of before that I think we'll be able to prepare for better in the future as a result of this.
It's inspiring to hear that, because there's a lot of lessons that are to be learned. My mom used to say, watch and learn. And you and your organization should be commended. I know the people in New Mexico appreciate your diligence and your commitment. And the caregivers are more than just those at the bedside. They're all the men and women behind the scenes that orchestrate. So on behalf of all of us who are sitting at home and doing podcasts, we express our gratitude. I'm going to turn the back over to Bob Kaiser in a moment. But Dan, to finish today's podcast, if you could give us 2 or 3 lessons that you've learned as a leader. Remember, there'll be a number of professionals listening to this podcast and students. And so leading in a pandemic is probably the title for our next book that will be talking about how you deal with ambiguity. But before I turn that over to you, then back to Bob, I just want to say thank you for your tremendous leadership. You're an example of leadership that is purposeful, intentional, and we're grateful for it. So with that, Dan, 2 or 3 words of advice or principles of leadership that you think we need to be aware of.
Thank you. I appreciate that. I think one thing that has been big is that, especially in emergency, you can't create trust in the very moment that it happens. So you have to already have had, as a leader, in order to communicate effectively, those who you lead have to trust you. And so I think that those relationships have to be built from the very second that you step in the door. And so in this emergency, if I didn't have relationships with my medical staff and my employees and my board and all of these different things, then there may be much more unnecessary fear or concern because the communication wouldn't be as effective if they didn't trust me. So I think, and not saying that I've done anything perfectly, but communication is one thing where, and that's probably the second point. The first is trust through relationships. The second is there has to be constant communication. And that's what's always on my mind is the questions come and the fear comes when there's ambiguity or people are unsure of even our PPE levels or our level of preparedness. And so I'm constantly out in the hospital still trying to answer questions, trying to be present with them, helping them know that they have support, that they can ask questions when they have them, and that we can do this together. If our hospital is the pillar of confidence in the community, then I have to be the pillar of confidence amongst our employees in the hospital. And so the constant message out there is that we're in this together. We're all here to support each other, and we can get through this. As you see these heroes out, caring at the bedside for all these patients. And so it's a really pretty incredible time.
Thank you, Dan. We really appreciate it. Bob, thank you for allowing us to be part of this podcast.
Well, yes, it's very, very pleasant to hear 2 CEOs be able to relate from past experience and current experience. I know, Britt, you've had a tremendous background in dealing with matters like this, and it's really encouraging to see what Dan has picked up with as a servant leader, seeing that he is present. I know that people have to be vulnerable also in situations of leadership like this. And Dan, I did have a question for you. Just how serious is the community addressing this? Obviously, if you're in New York City and you watch the news and you see the magnitude of it, it's pretty intimidating. In more of a rural area, as in Hobbs, New Mexico, what's the community like? Are they seriously embracing this? Do they really see this as a threat, like a lot of people do in the larger scenarios?
I think that it's taking a little bit longer. I think in the rural area, you still see Walmart's parking lot full. You still see a lot of people out driving that probably don't need to be. The executive order went out from our state government that all non-essential businesses have to be shut down. But there were a lot that I might not consider essential that are still open. And so I think that it's taking a little bit longer for us to really realize the gravity of it. But as soon as we had that first positive when we did our press conference last week, you started to see a lot more testing happening. You started to see a lot more influx in the emergency room, a lot more phone calls, a lot more concern, a lot more social media presence from people encouraging others to stay inside and to social distance and to practice all these things that we've known for a while now. You started to see a lot more pressure, peer pressure from those on social media saying, this is the way to. So I think that it's picking up, but not nearly as much as it would if we started to see it creep in a little bit more. So we have some larger areas close by. Lubbock is just across the state border. They have a lot more presence than us. And so we may begin to see it more, but I think that people need to continue to take this more seriously practice those social distancing, obviously hand hygiene, all those things that we've been coached on and worked through so that we can really do our part in stopping the spread.
Yeah, I agree. I've heard it presented, wash your hands, social distance, cover your cough, and it's not a joke. Take it very, very seriously. Yep. Well, we want to thank Britt, and we want to thank you. You've been listening to Dan Springer, CEO of the Community Health Systems, for joining us for this very special period of adjustment in the healthcare industry. So thank you, Dan. Keep up all the things you're doing, and we look forward to hearing from you again.
Thank you, Bob. Thank you, Britt. Great to talk with you both.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.